A new report found the majority of Texas residents in need of mental health care are unable to access that due to a severe shortage of mental health providers. That is leaving patients to seek care out of network or go without it altogether. That is according to a report released today by Inseparable, a national mental health advocacy organization. Here to tell us more about those findings is Angela Kimball. She is the Chief Advocacy Officer at Inseparable. Angela, welcome to our show and thanks for being with us today. It seems like we might be having a little bit of an issue bringing in your audio, but we'll work on that here just for a few moments. Angela, first question for you. Walk us through some of those key findings in the report and the factors that it took into account.
Me?
We can hear you now, yes.
Okay.
Great.
Thank you, Will. It's great to be here with you.
Yeah, thank you for joining us again. Again, just maybe walk through some of the findings of the report and the factors that took it into account.
Sure. So, Will, one of the things that we discovered is that wherever we go, people tell us that they need mental health or addictions treatment, but they can't find a provider. And we decided to dig in and look at this issue more closely. So, what we found was really interesting. First, an underinvestment in the workforce pipeline. We also found low reimbursement rates, and we also found over-reliance on a narrow range of providers. So just digging a little bit deeper, particularly in Texas. So one of the things that affects that workforce pipeline is there are high education costs, unpaid clinical hours, and a difficult licensure process. And frankly, that keeps a lot of students from being able to even enter the workforce. And then when you look at low reimbursement rates, so in Texas, a licensed therapist makes just 73 cents for every $1 that a physician's assistant makes, even though they have very similar education and training requirements. And the third piece, this over-reliance on a narrow range of providers. Texas, like a lot of states, really relies on psychiatrists, psychologists, those licensed mental health professionals. But there is really a way to help address the mental health workforce gap, and that's by actually expanding the number of provider types that can help provide some services. So when states do more to promote the use of peer support specialists and paraprofessionals, much like we do in the physical health world, you have this ability to actually stretch the workforce further and allow more people to get the care that they need.
Of course, we want to highlight the situation here in our state, in Texas, but is this a problem unique just to our state?
Oh, no, absolutely not, Will. This is a problem across the country, and the bigger the geography of state, the more rural areas, typically the bigger the challenges are. But it isn't limited just to states with large rural areas. It's even in smaller states that are more densely populated, like a Delaware, for example. And what's really important about all this is that the impact is really significant. So when Texans or people anywhere in this country can't get the mental health and addictions care that they need, they very frequently end up in emergency departments, on the streets, in child welfare, or even in jail. And this puts a burden on state systems and taxpayers and just untold stress on families.
And finally, Angela, while we have you here, what should people know if they are looking for affordable mental health care?
Oh, honestly, they should be calling up their state legislators and saying they need help. They need accurate provider directories, they need help navigating the system, and they need investments in that workforce pipeline because everybody deserves the access that they need. And it's possible. We just need the policies that are going to make that happen.
The next legislative session begins next year, so we'll see whether or not that's a big focus of conversation at that time. But Angela Kimball with Inseparable, thank you again so much for talking to us today about all of this.
Thank you, Ryan.
All right, we will head to break and we'll be back after this.